chiropractor, Dr. Gregory Johnson. We have Reggie here with us this afternoon. This is the Monday following the historic Super Bowl here in Houston last night with the New England Patriots. I want to say congratulations to them and Tom Brady and Bill Belichick and the entire city of Boston, New England. I'm a big Patriots fan myself, and I tell you, the Falcons, though, played really well, and it was a good Super Bowl. A lot better in the second half than it was the first half for me, but anyway, Houston did a great job putting it on, so I want to congratulate the city of Houston officials for doing that and all the volunteers that made that happen, and thank you, God, for the beautiful weather that we had the whole week. And we're going to do this video with Reggie today because Reggie's been to other chiropractors before and had other types of treatment for musculoskeletal disorders. And we get this question a lot. How long does an adjustment last? How long does a person feel better after getting their treatment here? And I'm going to let Reggie answer that.
My first visit, it was immediate. So it lasted me for a couple of weeks till now.
So this is your second visit here only, right? And the first adjustment lasted you a couple of weeks after the very first time initially?
Yes, sir.
So, I mean, it can vary from person to person. Some people, they'll go back out and they'll jump in their car and lean over on their armrest and they'll go back out of place right away. Or they'll get out in the elevator and bump their leg and walk funny and they'll get knocked out of place right away. So it can last anywhere from a minute or two to 2 weeks to 6 months. We had a guy that came in here and had been in here for a year today. So it varies per person and how you sit, how you lift, how you bend, how you stand, how you walk, how you do all of your activities of daily living. So that's why I tell people how to sleep on their back with no pillow and their legs elevated all the time. To do these exercises, I bet you've been doing some of those, haven't you?
Yes, sir.
Yeah, so see, it's the patients who do these things, they get the best results, they get better faster, and they stay well longer. So let's show them what number 2 looks like today, Reggie. Let's have you flex your head forward and backwards for me, please, sir. And then neutral. Plus the combination of the things that we do here at Advanced Chiropractic Relief with me adjusting 3-dimensionally and then Joseph doing the deep tissue work and the myofascial release on a person, plus showing them the home exercises that we recommend, therapeutic exercises, helps tremendously getting those two things in combination. Okay, so Reggie's head's a little bit forward and cocked off to the right. Do you see that, Reggie?
Yes.
It's not translated to the right. His is translated a little bit left, but it's kind of cocked off to the right. And you see how you have a lot more room over here than you do on this side?
Yes.
So your pelvis has translated left. So let's come over here and do the manual decompression first. I had a lot of people in here last week from out of state for the Super Bowl. And a lot of them came in here that I thought was here for the Super Bowl that just came here for us. There we go. In fact, that was the majority of them, wasn't it, Joseph?
Pretty much, yes, sir.
Okay.
That pain is good.
It slide down just a little bit. Yeah. We're still waiting on our pins. These are already bent again. It's not for me dropping them on the floor either. It's for my old man's strength pulling. That's not Reggie or me either. That's the table. There we go. I'm gonna have to tell them everything, or they'll be making stuff up as we go. There we go. You feel that all the way down, Reggie?
Oh, yeah.
Yeah, good. Okay. So when I throw them down, I don't throw them down on the steel pin part of it anyway. Okay. Oh yeah. Yes, sir. Good job. And also when a patient relaxes, I think it also does better. Okay, Reggie, we're going to have you come over here and line your stomach next, please, sir. And see, he's getting that properly sideways, pushing himself up with his elbow the right way. Hang on one second. Legs are even right now. That's a good start. That doesn't tighten up too bad, does it?
A little bit. Not too bad.
Yeah. So, he didn't have either leg short, but he had a little bit of a elevation and tightening up in his pelvis when I brought his legs up. That shows mostly sacral deviation, which is where I'm at right here in the center of his pelvis. There. And now I'm going to get on L5, straight P to A, posterior anterior, L4, L3, L2, L1. There. Okay, just keep breathing normal. There we go. There. I still got some right there. Yep. You feel those on that second go around?
Good, sir.
Sometimes I have to go back and get them because you bucking too much on the first one. Tell me if this feels any easier to you than the first one, Reggie.
Much better.
Easier.
Yes,
Good. So now I'm adjusting his cervical spine, P to A also, posterior to anterior in the Z-axis. There we go. Okay, let's turn you on your back now.
Shut it down.
No, you're good. Right there. Okay. There we go. Yes, sir. Now slide down this way a little bit and put your arm straight out to the sides. Just relax your leg right here in my hand now. There we go. That's it. Okay, now let's sit you up, face this way. Keep your chin and head up. There you go. There. Yep. There we go. There we go.
My right ankle is jammed.
Okay, lean your back for me. He said his right ankle was jammed, so I'm going to adjust his right ankle at the talus where it meets the end of the tibia and fibula. I'm going to adjust the left one while we're doing it. There we go. Yep, that's better. Good. We'll stand up here in front of the mirror. Okay, let's have you flex your head forward and backwards again. Yep. And right down the middle, look how much more space we got now. Let's pull these guys here. Yep. Good. Okay. Now, try that same thing again. Yep, you're right down the middle everywhere right now. You hurt anywhere at all right now, Reggie?
Sir?
Okay, so remember the topic of this video is how long an adjustment lasts. That all depends on you. Reggie's not, we didn't put him on 3 times a week for 3 months or anything like that. We don't put patients on big long treatment programs here. We adjust them and teach them how to look at their own posture and what to look for, start tightening up. That's when they know to come back in. That's what you did, right?
Yes, sir.
Very good. Well, thank you for sharing your experience with everybody. This is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas. We'll see y'all soon.